This is one of the much debated, hyped, and discussed topic pertaining to medical value travel. And I'm Deepak. I'll give a quick prologue that whenever we talk about medical value travel, it is said to be one of those domains in the industry which can yield high dividends. And if you look at the projections, the global projections for medical value travel can be as high as 275 billion US dollars by none other than 2026. But when it comes with reference to that of India, there are various stakeholders, whether you talk about the hospitals, whether you talk about the Ministry of External Affairs, whether you talk about WTO, or whether you talk about those agencies or those private hospitals which actually are giving this medical value travel. So I'm happy to invite all the panelists here, which represents the various diverse sectors where which will actually give their own perspective on the same. But before that, I hand it over to my fellow moderator, Dr. Gaurav. Gaurav?
Yeah. Hello. Good afternoon, everyone. So nice to be here at CAHOCon 2025. Medical value travel, the topic is opportunities and challenges. So it's a very, very hyped word, medical tourism. We have to really look into the other aspect, that are we really tapping the potential of our country with regard to medical tourism, number one. And number two, what are the opportunities with regard to the sector? Number three, the challenges what we as a nation or as a sector are facing to grow this medical value travel. But the other challenges are which the world is facing, the challenges in terms of the healthcare delivery there. So that brings opportunities to us. We have a very, very esteemed panel for discussion today. There is a representation from Ministry of Commerce, Ministry of External Affairs, somebody from Public Health, people who are driving the international emergency transfers from point A to point B based from Middle East and covering Saudi Arabia. So we have a good panel, so we can have a good discussion. So we'll start with Mr. Pankaj Mishra. He represents the Ministry of External Affairs, and we can have his take and his opinion about what does Ministry of External Affairs is looking at this sector and this opportunities with regard to this sector at medical tourism.
Thank you, Gaurav. Myself, Commandant Pankaj Mishra, Officer on Special Duty, Director Rapid Response Cell from Ministry of External Affairs. So this division, which was primarily formulated and created in 2021, aims at supplying the COVID-19 vaccine across the globe, wherein we have supplied around the vaccines to almost 110 countries. And lately, we have been entrusted with the responsibility for the division which looks after the HADR assistance, the response mechanism upon any disaster. So while doing this activity and reaching out across the global south, whenever you respond to any disaster or any situation, one of the important aspects is the health, the condition of the personnel, the injuries that has been sustained, and towards this, our relief material comprises significantly of the medicines, the medical items, the surgical equipment, and the other healthcare related equipment. So while we are establishing our image as the first responder to the global south and Indo-Pacific countries, and as a whole to the globe, and also as a credible humanitarian assistance provider, and re-establishing our image as the pharmacy of the world, we hereby look after that. How do we reach out in a minimal possible time, providing our qualitative and effective medicines all across the globe? Toward this, we are promoting our medicines, our equipment, not across to our neighborhood, but to the Latin American countries, to the Pacific Island countries. We are reaching to the Vanuatu, Solomon Island, and to the Latin American countries, which are far from our territory itself. But here, our image, our intention is that let us be the one wherein we can also showcase our effort to the globe. Let's see, we are the one who can reach out all across the globe within the shortest possible time. Towards this, our government has taken various initiatives apart from providing the equipment and the medicines. How do we intend to promote the medical travel in the context is that we are trying to develop a trust among the patient about the Indian pharmaceutical industry, about our healthcare system. By doing this, so we have made our endeavor that most of the countries have started accepting our Indian pharmacopoeia. We have taken a collective effort wherein the discussion are ongoing, and you can find the data online that many countries have accepted our Indian Pharmacopoeia Commission, which will provide a great boost in our healthcare sector. Apart from that, as per the announcement made by Honorable Prime Minister to set up a Jan Aushadhi Kendras all across the globe, India is also putting up an impetus wherein we can open the similar Jan Aushadhi Kendras, which will provide the quality and generic medicine all across the globe. So our Honorable EM has inaugurated one in the Mauritius and Guyana and Nauru, and many are in pipeline. So our also we are considering to plan a scheme similar to the Ayushman Bharat and telemedicine, wherein the consultation part for the patient who intend to travel to India, and also provide some scheme which will help them in undertaking the treatment at our own country. So these are few of the initiatives that we look forward. Our aim is to first build a trust across the globe so that we are the credible partners wherein you can look forward for undertaking the treatment. We are here to facilitate you. We have got some few data, in-house data, which we have got from our consular and passport visa division, which shows that these are the sector which primarily looks after the healthcare that they do often travel to India for undertaking the treatment, or this they like to do their treatment in India. Mostly, as of now, this sector belongs to the African and the neighborhood, our neighborhood. But we are also trying to ease out these visa policies as well, so that there's a ease of patient or the personal traveling to India. Thank you.
Thank you very much. And after hearing from Sir with a very specific perspective from MEA, I'd be very happy to introduce Dr. Pralok Sir, who actually will be throwing more light on the trade aspect because he represents WTO. So, sir, may I hand it over to you to actually deliberate on the very specific focus on the WTO's perspective and the trade related queries. Thank you.
Thank you. Yeah, thank you. Uh, um, this health services is one of the services sector, and WTO deals with the services sector. So that way, the health services or medical value travel that comes very much within the ambit of the World Trade Organization or trade liberalization. But the irony here is that though health services are very important, and we know that health services are beneficial for everyone because the patient get treated, he or she feels good, his or her family members are feel good, and the person can increase the productivity in his or her own country. But at the same time, somehow many countries, in fact most of the countries under the WTO, they have not taken any trade liberalization commitment. So they are very reserve or conservative from health services perspective. And the reason is probably because health is a sensitive sector. They consider that patient security, patient safety is important. So, but nowadays, in the trade agreements or at the bilateral level, a lot of discussions are happening for increasing health services between the countries. But two important challenges I would like to highlight from the trade perspective. One is the insurance portability. When foreign patients are coming to a particular country, then generally the insurance service provider in that country, they do not cover the expenses incurred on the other country on their health related aspects. So that limits the foreign travel of patients in other countries. It's the same like in India, if we want to travel to other country like for US or UK, and if our insurance provider is not covering our expenses, it is very unlikely that on our own we go to US or UK unless we have very good financial situation. The other issue is the recognition of qualification. And this is important first because many times if qualifications are not recognized, then insurance is not provided. Second, when patient after the treatment in a country goes back to its own country, Then there are certain follow-ups. There are prescriptions, medicine prescriptions. Now, these cannot be prescribed unless your qualifications are recognized in other countries. So that is a significant bottleneck. And again, there are efforts that are happening, but in the WTO, unfortunately, nowadays not much is happening because we all know that there is President Trump has come out with reciprocal tariffs and which are against the spirit of the WTO. So that way there is a stalemate in the WTO. But still at the bilateral level, a lot is happening on the health services front, and there are recognition by countries that health services is in the benefit of all the nations. Thank you.
Thank you very much, Dr. Pralok. May I now ask Dr. Monika if she can more explicitly tell about this debate on if everything is done for foreigners, what about the Indian patients, and what about the equity angle? And is there any need for those accreditation which actually can put in India on the global standards? Madam, up to you. I just missed out. Maybe it's good if you can introduce yourself and then maybe speak on. Thank you.
Sure. Hello, everyone. I'm Dr. Monika Kochar. I'm Advisor Health with Dakshin, Global South Center of Excellence, which works very closely with Ministry of External Affairs. It's an autonomous body. At the outset, I would like to thank IIPH for bringing me here and giving me this important podium to discuss. As a public health professional, it is very important for me that this question be answered. So when India is projecting itself as a global healthcare destination, it is important that the local population, the rural people, the rural population or the underserved population are not left behind. And to ensure that we become a global destination for healthcare, so we need not choose between global excellence and domestic equity, but we need to pursue both deliberately and strategically. That is very important. And there have been several case studies in Thailand. If we can say, we are already projecting that healthcare sector, this MVT is going to become a 15 billion USD market by 2026. And all these revenues which are being generated can be easily redirected into public health infrastructure. Our public health infrastructure, which is for the poor, which is for the local population, can be strengthened. That is a very important aspect, the redirection of the revenues. It is being done in healthcare in Thailand. We have a very strong case study there where they have earmarked levies on the hospitals which are working with the foreign patients. And then second is the regulatory levers for cross-subsidy. Many hospitals, they are working on subsidized lands, which are given to them by the government. So these hospitals can, in return, take care of the underserved population, the poor patients of our country as well. This is already being done in Delhi and can become a national strategy. And that is how the tier 1 hospitals can, take care of the patients from the local populations as well. And then third, we already are working on digital systems, ABDM. We are working on telehealth for the foreign nationals to give them services across borders. Now, these services can be translated to the services given to the local populations in India as well. A lot of research is happening, a lot of MOUs are happening, capacity buildings can be done, trainings can be done, and that is how whatever is being done for the international patients can also be replicated for the Indian population as well. And that is how we need to bring equity for the Indian populations while we project ourselves as a destination for the foreign nationals for healthcare. Thank you.
Thank you, ma'am. But I think another aspect, as we were talking about the accreditation. So it's important that India projects our hospitals in terms of our international accreditation standards, because that will give the image of we delivering quality healthcare to the international market. Second aspect, which you rightly said, is the ethical care. When you project your care, which is ethical, which is quality driven, automatically you create a market globally. And globally also the challenges are of various kind. There are Western nations which are struggling to deliver healthcare, and then there are nations which patients come from, even poorer countries like Africa, even Bangladesh, which we are getting a lot of patients. So we can categorize our international medical tourism market into practically 3-4 categories. For category 1, where patients are coming from foreign countries which are price sensitive, you can deliver how you deliver healthcare in our country. Patients who are coming from comparatively developing countries for various kinds of procedures, and then patients coming from even the Western countries which are struggling there, whether it is the UK system or the US system, where the patients can come for high value treatments and procedures. And that is where the role of accreditation standards for our country and listing of hospitals will help us to project that. We also have Dr. Mohammed Afsal. He is the medical director and chief flight physician for Bluedot Air Ambulance. He is based out from UAE, Dubai, and covers a lot of region in terms of air transfers for medical patients. So I like to ask him to give his take on how he sees this sector of transferring patients from there, and what are the opportunities and challenges which they face as a air transfer, service providers.
Yeah, so in Blue Dot, we are specialized in two modes of transfer. One will be the commercial flight stretcher transfers. We utilize the normal passenger commercial airline, like any other part of the world. We use that. And we also have the private transfers in the private aircrafts. So when we talk about the logistical challenges, it's mostly, go around in the commercial flight sector, where there will be the availability is the most important factor. As our national carrier always give the availability as in the stretchers, in the oxygen, all these parts. So this makes a void in the system, and it keeps the transfers delayed for the needy. So that's one of the most major logistical challenge that we face. And in this goes same for the air ambulance, the second one, and the commercial is the acceptance part. So when a patient or a client want to travel to India, this the confusion about where to travel to, which hospital to go to, they shop around and look into a lot of people. There is no single one point check system for us, for the patients or their family or insurance for that matter, to look into, to see where they should find the best quality care, a reliable quality care, which has been accredited by any of the national or private bodies. So this is one lack and one logistical challenge we always face. So the opportunity here is that Indian aviation industry is so huge. It's not just our national carrier that we can rely upon. There are a lot of other private carriers as well. They can be supported to transfer patients in. When I'm saying transferring patient in commercial airline, is not just a patient just walking in. We can even transfer critical care patients in a commercial aircraft. So other airlines should be supported from the government and the accreditation bodies for that matter to transfer patients globally. This can bring in a lot of patients. They can bridge the gap. The second major important factor, and that's more relevant to our subject, is the quality and accreditation. So our Indian air ambulance industry flies around a quality vacuum, a void, where there is no regulatory body to regulate any of these air ambulance services. But that goes same with, we started off in Dubai, where when we started, we understood that we are just an office running an air ambulance. We approached the health authority and we asked for an accreditation and a license. Even they didn't had any. Then we went to the ambulance service, DCAS, which is in Dubai, and we convinced them to have an accreditation and a license, and we were the first to get that in UAE. Then we looked into the West, and then we saw there are a lot of other accreditation agencies like URAMI, for that matter, in Europe, CAMS in Canada, NAMTA in US. So we went for the URAMI, which was one of the leading accreditation agencies in Europe. And with the 1 year stringent checks and audits, finally we got that. And that gave us a visibility as an air ambulance company. When we come back to India, the region, then we looked into some agency or any government body which can give an accreditation or license like that. But we don't have any, and that's a big void which we really want to look into. And that regulatory body will not just regulate the commercial, private air ambulance, but also the commercial side of it as well. So this void has to be filled in, and that regulation, just like JCI or NABH, when I say Urami, we looked into Europe and saw that Urami part as a brand international. NABH as an Indian accreditation can definitely be an international brand. We have to uplift that and show it as the brand, and that's what we would like to have.
Thank you very much. And I have been listening to all panelists, but I have one question to my fellow moderator, Dr. Gaurav, who is Vice President and has been, Head of Operations for Max. Dr. Gaurav, my question to you is, and I hope you don't mind, what is the perspective of the private industry? You represent that hospital with very specific reference to two things. One, the changing political scenario, and number two, once they come here, so the post travel back to their hospitals, how follow-ups are done, and what is your take on what actually can be done to enhance the medical value travel? Thank you.
See, thank you so much. So I suddenly become transition from a moderator to the panelist, but I'll give you my take of the medical value travel, what is happening currently. See, obviously we represent the private corporate side. Max Healthcare is one of the most prominent and dominant player in the NCR region in terms of medical value travel. But let me also tell you, it's a lot of challenges. To get this business. This business is still unorganized. It is not organized at all. This business, if you compare it with our domestic business, I would find the domestic business more economically viable than our international medical value tourism, because of it is driven primarily by the so-called facilitators or so-called agents who are working and getting patients from one nation to the another nation. We all know that India is now nicely poised to grow this business at a big scale. The only thing what is limiting us is first the projection of our nation in terms of the quality what we deliver, in terms of the healthcare spectrum of procedures, right from organ transplants to niche procedures, as we were discussing about even aesthetics or everything. So the world has to know that, and India has also played a very important part in crisis management. So Indian healthcare delivery systems, Indian pharmaceutical sector, as he was just mentioning, has to be projected that it is very quality driven and also comes at a good price point, not at a cheap. We don't want to use and project ourselves as cheap medical delivery systems in the nation. Second thing is, how do you project it? When we have stronger accreditation systems like NABH, CAHO is already driving quality at a national and global level, aligning with ISQA. We need to project that, yes, our quality standards are up to international standards, and patients who are choosing us will be choosing any international standards of healthcare delivery. Third is, you become really valuable when the customer chooses you directly, whether it is directly out of pocket or insurance companies which are based in various nations. They should be able to choose us and they should be able to facilitate us. And that is where listing of hospitals, when you are listing your hospitals at a central level, when the government also partners with the private sector and projects, it is similarly like automobile sector. We are producing cars for our nation also, and we are producing cars for the global market also, because we produce good cars at a standard procedures, and it is global standards of safety what the cars are being produced. Similarly, we can deliver healthcare, as madam was telling, to our nation also, that we set our healthcare priorities for our nation also, but parallelly we project our healthcare systems for the globe also. We can't mix it. Because if we mix it, then we will not be able to capture the potential of the international market, which is rightly available. Because if we don't get into that bandwagon right now, we will miss the bus. Already Turkey, Southeast Asia, or already Thailand have already taken leads in projecting themselves in the international market. So if we lose this opportunity, and the private players cannot do it in isolation, government knows the potential. And we have to understand why this topic has been chosen for panel discussion at CAHOCON. The topic has been chosen today because we know the potential. If we don't tap this potential, we are losing big economic opportunity, not only for the sector, but also for the huge employment opportunities which will be missing. Right now, India has the best expertise in doctors, best expertise in nursing, best expertise in paramedical, technical side. We have the technology available with us. Our processes are more better and streamlined and strengthened. The care delivery is much better what it was earlier. And our pharma sector has really shown the world that what we are able to get to the world. So listing of hospitals, categorizing of the hospitals will make things easier. Insurance agencies tie-ups will make help easier, and technology, as you rightly said. So most important part is for the patients now who want to travel to India or want to avail our services. With the post-COVID era, everything is available on VC. We can have these platforms where the patient can consult our doctors. They can send their prescriptions. A preliminary diagnostic workup can be done at their place. A diagnosis can be reached. A package can be given. A pricing point can be given. Conversation can happen very transparently. And when the patient now chooses to travel, the ease of travel through help from the government, through commerce industry, to external affairs industry, ministry, separate visa windows, immigration windows when they land, and then the pickup and procedures and post procedures. When you align with actually hospitality sector, we can actually grow. See, everybody has to understand. Even I was talking to somebody senior in the hospitality sector. The hospitality sector cannot grow only on marriages and banquet hall functions. Hospitality sector, every sector needs foreign tourists to come and get foreign currencies, and the economy will grow. Similarly, medical tourism and hospitality then aligns post-care. And then our mystique of yoga, Ayush, all these services can add to the end-to-end spectrum of the medical tourism sector to grow. And that is how I think we should project it. Technology post-procedure. I think post-procedure and post when they go back. Our doctors are traveling to almost every country. So post-consultation can even happen in those countries, and post-consultation can happen through VCs also. Our doctors from our hospitals also travel to so many countries and develop, the other thing which everybody has to understand, many countries don't even have high-end programs in their nations, and these are developed countries. Bone marrow transplant program, we recently developed the bone marrow transplant program in the country like Georgia. We are developing and giving mentorship to many good hospitals in good nations like in African countries like Nairobi. Western world, we are tying up with NHS because the waiting times are so high. Those patients don't even have, 6 months for a knee replacement. Those tie-ups can be done at a country, at a government to government level, and the patients can come to us and get those procedures done. And niche procedures, what he was talking about, hair transplant, aesthetic surgeries, all the spectrum of procedures are now available in our country to deliver. Only thing is that we need to market it, we need to position it, we need to brand it and deliver it at high quality, good price, not high quality, cheap or anything else. So technology, aligning with the government sector, positioning it, ease. Every patient who's traveling from abroad, whether from African countries or Western world, needs ease of comfort, ease of travel, safer journey, safer treatments, and safer post-travel back. And that all thing can be easily delivered. Now the country is poised to capture that position in the world. And India, with the aviation sector growing, and our nation and our most of our metros being the hubs of air transfer and what he was just talking about, we can take that opportunity because the travel time for India from any country to any country, 6 hours, 7 hours, 8 hours is doable. Even from US East Coast, we can direct flights, 12 hours, we can reach Delhi or any metro city. So for patients, it is very easy. The only thing is we have to understand this opportunity. It's a big opportunity. If we leave it unorganized, like what is happening right now, we will miss the bus and we will just keep focusing on very low value medical tourism. If we grab this opportunity in a structured way with the people representing the ministry here and very rightly said by him, the pointers and suggestions given by him, I think we are poised to be the biggest player globally in terms of medical tourism.
Thank you. And I'm cognizant of the time. My last question, which is pretty open to any one of you who would like to comment on, are we ready to have something which converges almost everything? Can we have something like a Zomato or something like Swiggy? If I want to have vada pav, I can offer it from. Can we have some platform whereby we have representatives from ministry, representatives from academia, CAHO, who actually can facilitate this discussion? Are we really ready? Because this is one of the important questions that we need to answer. And I look forward for your opinion, and possibly then we'll end. Maybe any one of you can pick this question if they really want to respond. Sir?
No, certainly there is a lot of opportunity because this is the model uh, which which is the need of our the foreign patients. They also require authentic information at one place, and this kind of model like Zomato, Swiggy, where you have all the information at one place, and more important, authentic information. So that is certainly the need of our. There were some efforts in this direction. Ministry of Commerce itself, in 2000 around 16, we tried to develop some information, develop a website with the Services Export Promotion Council, providing some information. That did not reach that level because of a number of logistic challenges. But this is the time because now we have grown up. 2016 was the time when medical value travel in India was kind of in emerging. It was in a nascent stage. But now we have come up significantly. After that, COVID-19 pandemic, we have successfully recovered from the pandemic, and we have shown to the world that what kind of medical facilities we have. So this is the time that this initiative which IIPSG is thinking must be taken up, and we should develop such kind of platform with authentic information. Thank you.
Uh, Thank you, everyone. Just wanted to add one point and also a open question to everyone. See, while we discuss on this medicine and the treatment part on the healthcare sector, the very important question is that the trust which we have on a particular medicine or the particular healthcare system. In the last year, during August 2024, Ministry of External Affairs in collaboration with Ministry of Health and Family Welfare have conducted a policy maker visit at a senior level. The participants were from the DG, DDG level, and almost 20 plus countries have participated. So while interacting with these participants, the delegation, we could understand that still there's a lot of cobweb in the mind of people about our healthcare system, about our medicine. And during visits to their pharmacopoeia commission, to our best of the class hospitals, to our manufacturing plant, even to the units at Hyderabad where vaccines are produced, a lot of things got clear. Their understanding, their acceptability to the Indian medicine, and various other factors which were there in their mind, which may have been induced by some of the various factor. We need to clear all these issues so that we can see, sitting over within our India, we need to understand that we can't keep boasting about our healthcare sector until unless the message has been appropriately promulgated among the people. So government is working on the various scheme, also on the platform, which say you rightly mentioned that similar to the Zomato or the Swiggy, we are working onto the platform where which will be easily be accessible by everyone. Our person looking forward for the treatment, long term, short term, can have access to those platform and get the things at a easier thing. So endeavor is to have built up trust across the globe about our Indian pharma industry.
Thank you very much, sir. And I hope we end this. I have been given signals from there. Thank you very much for your patience hearing. And in paucity of time, we'll not be able to offer any question on it points, but during the tea time, we can discuss this. Thank you.
Thank you, Dr. Saxena. It was an enlightening session. Let's give them a big hand. They have enlightened us on travel, medical travel. Thank you so much, sir. Let's please join for the photo shoot, please.